Hello. This here is Professor Clemmons. He's here to help me with your symptoms.
Hello. It's nice to meet you. I've heard great things about you from Dr. Lloyd. It's a pleasure to be here and to finally meet you.
We just have some questions and then we'll perform some tests on you, if that's okay. Okay, great.
Just excuse me, I'm going to put my bag down.
Okay. Just going to take some notes here.
You'll have to forgive my attire. I was kind of in a rush to get here. How long have you been seeing them now?
It would be a year right now.
Okay.
Okay, just have a few questions here. Have you had any new allergies since last time we met? No? Okay. Any new surgeries? No? Okay. With your current condition, have you had any new symptoms? No? Okay. Have you had any strange dreams? Any nightmares? Okay. Have you been having any hallucinations? Okay. During your daily routine, have you been having any strange or unusual thoughts? Okay.
Interesting.
Definitely. Okay. Well, next thing I want to do is take your blood pressure. Okay.
I'm just, while he's getting ready, I'm just going to ask you a few questions myself. Let's see. Have you been visited by any strange creatures, ghosts, anything of that nature? Okay. Have you ever been abducted by aliens? Okay. Mm-hmm. And can you tell me what color is the number 12? Okay. Excellent. All right, so I think I'm done with my questions, Doctor.
You must excuse this, it's brand new. It's hard to pull off. Okay. Okay. Okay.
Does that seem normal compared to previous readings?
Yeah, it's very normal.
Okay. You have to forgive me, I'm not too familiar with your special patient.
Okay, pressure.
What was that now again? Okay.
Heart rate. Okay. Alright. Okay, the next test we need to perform on you is just a simple heart rate monitor.
I'll be interested in this as well.
Okay. Can I have you breathe in, just like this, and then hold? Okay, release. Breathe in. Hold. And exhale. Okay. Breathe in. Hold. And exhale. Okay. Would you like to take a listen?
Yes, please. Okay. I just want to listen to the heart rhythm first. This is a human patient, correct?
That is correct.
Okay. Sometimes I get a little mixed up. Okay. All right, and if you could breathe in and out for me as well. Nice deep breath. And exhale. And one more time. Breathe in. Exhale. Seems average.
That's what I got too.
For a human.
Okay. Looks like your next test will be eye exam. And with the eye exam, all it is you just follow the light with your eyes. Keep your head still. And just follow with your eyes and the patterns that I perform. Okay. Great. Okay. Okay, just stare right into this light right here. I'm just going to check how your pupils dilate. Okay. Okay, one more time. Perfect. Would you like to try?
Excellent. Sure, may I? Thank you. It's quite mesmerizing. Okay. Interesting. Okay. So, just follow the light. That's it. Excellent. Thank you, Doctor. You do seem to be quite healthy so far.
So far, so good, yes.
So, the heart rate, blood pressure, the vision. There is just one more test I'd like to perform. If you could just follow my finger. Very good. Side. Okay, great. Thank you.
Okay. The next test we need to run would be an ear exam, and I will let Professor Clemmons perform that test on you.
Okay, well, thank you, Doctor. Dr. Lloyd, you can assist me as well. Perhaps throughout this test you could maybe monitor their heartbeat.
Sounds good.
Okay. Alright. The first test is I just want to make sure you can hear me at this level. This should be your right ear. And then this should be over to your left side. You should be able to hear me just as well. Are you able to hear me? Okay, great. Okay, I'm just going to grab an item. Just a moment. How is their heart rate?
Stable.
Very good.
Okay, breathe in.
Let's see.
Breathe out. Breathe out. Okay.
Just a real simple, just to see how acute your hearing is. I'm just going to be using a variety of objects that are quite safe. So I'm going to hold these up close. Hopefully you can hear the separation between your left and your right ear. Can you hear that? Oh, well. Would you care to try?
Sure.
It's quite a simple little test.
Okay, can you hear that in this here? How about in this here? Good. Very well.
Okay, excellent, doctor. You seem to be responding well. Let's see what else I brought with me. I wasn't able to bring everything just due to the rush.
I'm going to monitor your heart rate during this procedure.
Yes. Excellent. I just want to see how well you respond to these sounds while the good doctor monitors your heart. It should have a calming effect. How was their heart rate?
Patient seems to be calming.
Excellent. Excellent. Then we'll just use a little visual stimulation to calm you down. Here we go. Would you care to try these?
Sure.
Okay. There we go. I'll make some observations as well. Excellent.
Just check your heart rate again to see the difference. Breathe in. Hold. Breathe out.
responding well?
Oh yes, that last test worked very well.
Excellent. How often do you treat them?
It's usually once a month.
Okay. So this is just another simple test. See how, like the other objects, how well you respond to these sounds. Hopefully they have a calming effect as well. Now, normally with my patients, I would put this over your head, but since you're not my patient, well, maybe if you were to come to visit me, I could give you the special treatment. Doctor, if you'd ever like to come visit me, I'd be willing to put this over your head as well.
Some thought.
Okay. How are they responding?
Good so far.
Excellent. Would you care to?
Pass on this test.
Okay.
Okay, so far your heart rate is low, stable, and very calm. That's a good thing.
If you don't mind, I just like to hear for myself. Can you breathe deeply, please? And exhale. One more time. Yeah. You're very correct.
I just have a few questions here for you. Your current medications, are you still taking them? Okay. And which ones are they? Okay. Okay, and how's that one working for you? Okay. Okay. That's.
Excuse me, doctor. Have you ever thought about increasing the dosage on that one?
Well, this one here is 300 milligrams, 300 milligrams, 600.
Try increasing it to about 2,000 milligrams and see how they respond.
Okay.
I've seen that work quite well for some of my patients. You may want to consider that.
Is that okay with you? Okay, great. Okay. Okay. Now I'm going to allow Professor Clemmons to perform some tests on you, in which I will also be performing and monitoring. Go ahead, Doctor.
Okay, great. Just not too unlike the previous tests. Just a little bit different. Paper cups. Paper cups. You can see paper cups have much more use than merely for drinking.
It's a very interesting technique.
Thank you, Doctor. It took me many years to learn how to get this technique mastered. Would you care to try? I will monitor your heart rate this time. You're quite a natural, Doctor.
Thank you, Doctor. Okay.
I just want to perform a few more of another test. And we're just going to use some nice calming hand motions. Just like this. Does that help you? Good. Hopefully you feel more relaxed. Possibly even sleepy. Okay. Right. Some notes.
Okay.
Well, doctor, I believe we performed a good number of tests. Is there anything else that you can think of that...
I agree. Looks like we have just one last heart rate check.
Okay.
Breathe in. Hold. Breathe out. Breathe in. Breathe out. Okay. Okay, one more time. Breathe in. Hold. Breathe out. Breathe in. Hold. Breathe out. Okay. Well, the tests have definitely helped. Kept your heart rate at a low, steady beat. Kept you very calm. If you would like, you can contact me or contact Professor Clemmons and schedule a follow-up. Okay?
Yes, I would be very much interested in having you come visit me at my facility. It was an honor to meet you, and Doctor, was an honor as well. Actually, before I leave, I'd like to give you my card. Here you go. In case you would like to stop by my facility, I'm quite impressed by your methods, and I'm sure we would have a use for you.
All right. Well, thank you. I may take you up on that offer.
All right. Thank you.
Thank you. Okay. And I will see you next time. Take care.